It's been an absolute privilege to meet Louise and Trevor. So what I'm going to do now is I'm going to hand straight across to Louise, who is a primary care nursing lead in the nursing director at NHS England, and Louise is going to introduce Trevor. Louise.
Hi, good afternoon, everyone. Can you hear me okay? There's a lot of echo.
We can hear you fine.
All right. So my name's Louise. I'm a registered nurse and I'm also the primary care lead at NHS England. So just a bit of background. Trevor and I have a long-standing relationship going back to about 7 or 8 years ago when I first met Trevor in Greater Manchester, and he brought a room full of nurses to tears with his personal story and his life skills. About 10 years ago, I was thrown in on a personal level to being a carer for my husband, who was in a wheelchair for 5 years. And although that was only a finite amount of time, it made me realise as a nurse how difficult it is for anybody to navigate the system and what kind of situation everybody finds themselves in, whether it's a loss of their job, whether it's a financial situation, and all the emotional and mental health needs that our carers needs. So I'm very passionate about supporting Trevor. So fast forward 10 years and Trevor and I have kind of got together and we came up with a bit of a plan that as the national lead for primary care, we would help provide some wraparound support for Trevor, both in his roadshows in Nottingham and within Yorkshire. So we've done 2 roadshows in Yorkshire so far, and just some of the headline data which we are capturing. We've seen 521 carers and families in over 2 days. And there's 45 to 50 health and social care and voluntary organisations that have been involved in just those 2 roadshows. And we've got a lovely audit from Sheffield, and they actually reached out to those family and carers and said, what did you think of the roadshows? And they said that 96% of those carers that attended said that they felt really valued and that they had the headspace and time to talk to health and social care professionals, and they really felt that was worth it on the day. So I'm going to introduce you to this wonderful gentleman who's an absolute inspiration, both on a personal and professional level. So over to you, Trevor.
Right then, first of all, can you hear me without echoing? Okay, everybody okay? Right, and I assume that you can hear me. Thumbs up. Oh, great stuff, right, yeah, thank you for that great introduction, Louise, and it's quite true. The roadshow is an opportunity to get good results and work in a different way to what we're all used to, and it opens up some very unusual doors and everything else. But to get round to what you've all been coming is to listen to what I'm up to, my me being an unpaid carer, my issues, personal issues, and also the roadshow issues and how things have developed over the years. You can all read my, you can all hear my my life story, my story as it was on the virtual Carers Roadshow, which I developed, and that's the life story I always talk about all the time. But this time I just want to bring you all up to speed, right up to the present day. So to start at the beginning, I've got 2 children. I've got a son, he's age 52. That's the virtual Carers Roadshow. Thank you, Steve. If you go to the virtual Carers Roadshow, it's 80 different videos on that, and it's a section of Kira's stories and my stories amongst them, but don't go yet. Wait till we finish the webinar if you don't mind. Because anyway, I've got two kids. Scott, he's 52 now. He's got learning disability and autism. He was born that way. And I've got a daughter. She's married with a child, my only grandchild, and she's a computer technician. A different end to the scale of opportunities between my daughter and my son. My son was born in 1971 with a learning disability and autism. We've always battled over the years with education and the transition into adult social services, and that battle does continue. But in 1985, I formed. I actually started to work for myself, and I created a contract cleaning business from scratch in Nottingham. Finished up employing 26 people full-time and also 150 part-time cleaners, and I did that for over 20 years, right up until 2005. During that period, in 2002, I developed type 2 diabetes. That was my first health battle. In 2006, I sold the business on in 2005, and in 2006 I created yet another business, an art gallery in Windsor, Ontario, in Canada, opposite Detroit, on the Detroit River, the US border. And it was very lucrative, a very lucrative business, art selling high-end art as a luxury, and it was brilliant until August 2008 hit, and the banks went tits up, and the world markets collapsed, and it took me with it. I lost £500,000. I lost my house. My wife divorced me. After 40 years of marriage, my son decided to live with his mum. He had no choice, because I walked into 2009. I walked into January 2009, broke, retired, homeless, and was 6 years of age, sleeping on my daughter's couch. So that was a very low ebb in my life, and my mental stability, your mind starts to attack you, and it took some pulling through. I needed to know, I needed to focus on something. And so I decided to try volunteering and focused on that, just to volunteer for things, just to try and keep me stable and get me on some kind of a recognizable track, because everything had gone. And then and luckily, the second meeting I went to was a conference in Nottingham in an hotel that NHS England was running, all about the difficulties and issues adults with learning disability had. And I thought, well, that's something I know about, bringing Scott up, my son Scott, from you know, all his life, still is unpaid carer now. But they never mentioned unpaid carers in the first half of the meeting. The second half, I stood up and I kind of took over, and I was just frustrated at the time, and it all poured out. I do what I do now, basically, and just say my mind, like, you know. After the meeting, one of the NHS England team, her name was Ruth Passman, asked me to have a coffee in the hotel where we were, and we talked at length for about an hour and a half about my experience as an unpaid carer. And then, funnily enough, in March 2009, the very next month, I was headhunted by NHS England and volunteered for them, recruiting staff for NHS England and the 50 vanguards scattered around the country. And I was travelling up to down to London or up to Leeds, staying in hotels 2 or 3 times a week, and it was that was what I was doing. But I didn't feel like I was making much of a difference to the plight of unpaid carers like myself. It's, but that was my feeling during the second year I was with them. But in September that second year, the decision was made for me, because in September 2010, I developed prostate cancer, my second health battle. I had to have radiation treatment from October 2010 through to January 2011. But the NHS saved my life, and they put me on a 10-year watch. And got me. I got to go to the doctors for a blood check each year. They're a right clever lot, the people at NHS. They're really awesome, quite honestly. It was the next month, March the 11th, and I decided to go back to volunteering, but this time stayed local in Nottingham and joined a host of different types of groups, advisory groups, strategy groups, ethics committees, and that type of thing. But the progress these organisations were making was so glacial that, again, I didn't feel I was making much of a difference to the plight of unpaid carers like me. Frustrated, I needed to know I could make a difference to unpaid carers. So in 2013, still going to these group meetings, but in 2013, I created what I call now is the Carers Roadshow by bringing together 94 local different organisations to populate the stalls, and ran multiple roadshows all over the city and county from 2013 to 2019. That's 7 full years, totaling 111 shows during and offering support for health, mental health and social care issues to 22,000 visitors that came to all the shows over those 7 years. And then COVID hit in 2019, and the whole thing came to a halt. During this period, in December 2016, I found a small amount of blood in my poo, and I placed myself on a bowel screening program by simply phoning up for the kit. This led to my first major operation in the 16th of February 2017. Never had a knife in my body, and the operation was for bowel cancer. It lasted 9.5 hours, and again the NHS saved my life a second time. It was it can't describe the feeling. It's, you know, all my cancers have gone now, fingers crossed, and but I have a permanent stoma, which can be challenging at times, and this kind of it's sacred challenging, but it has its moments, and I'm managing okay with it, like, you know. But that's my third health battle. The upside is I can wake up each day breathing, so life is great. Still experiencing. It's great to feel good in the morning now. Just waking up, breathe. That's what I'm trying to say, and to appreciate every waking hour. To get around the lockdown in 2020, I designed and developed a virtual Carers Roadshow. You could put the other screen up if you like, Steve. The first one was Carers Roadshow, the virtual one. To get around COVID, I developed this, the virtual Carers Roadshow, I got all the stall holders, all 94 of them, to say what they did on the roadshow on camera, send it to me. I put it on I created a YouTube channel, called it the Virtual Carers Roadshow. And now there's over, and it's of course it's 24/7 access. There's over 80 videos on there. You can go and see and at your leisure, and that's how I got around the COVID. I continued with the roadshow. It's all about roadshows that gives me the drive to keep them going, no matter what. Let me just bring you up to date with my son Scott's issues, because he's always been around in the background and such like, and to bring you up to date with my son's battles. Hello, somebody trying to say something? No? Oh, sorry, I thought somebody was talking to me. Anyway, I'll carry on. To bring you up to date with my son's battles, his mum, my ex-wife, died suddenly in March this year, leaving him on his own, but wanting to stay in the place where he lived, and he wants to live independently. But his mum did everything for him, so he's got to start from scratch. And to this end, he's got an adult care package in place for him, helping to clean the house, cook, buy the right food, cook the food, and make safe decisions for himself. This was set up in April this year, and my son has a care worker for 2 hours a day, 7 days a week, and that's in place for the rest of his life. It's a really good package, and is really, I'm very proud on the way he's responded to this enormous challenge in his life, and plus the fact I've got him back in my life now, and we're more like mates, so we see each other all the time. It's that's just great. It's I can't tell you how it makes me feel so proud of him. It's really good. Again, he's still got his issues, and it's not his fault. He lives near a park, and there was he often goes on this park, and he knows a lot of people on there. And there was a group of young lads attacked him. In fact, they finished up attacking him 4 times, once in July and 3 times in August. We reported it to the police, and the police are going through their bit, and they've warned them off and protecting him that way. But it's unfortunate that happens with all this challenging, all the stuff he's got to deal with. This just stuff just gets in the way, but that battle continues, and his circumstances are still precarious, but we're dealing with it, and we're dealing with it together, which is brilliant. To get back to the road shows in 2023, this year, post-COVID, now we're out of it, and so I did another 19 face-to-face Carers Roadshows in Nottingham City and County. But I also went national, as Louise explained to you, and I did 3 shows in Yorkshire with the help of Louise. Louise has been an absolute awesome person that's opened so many doors for me. And I did email her earlier today and say that about the 10 years we've known each other, she's changed my life substantially by opening some doors that's been I would never be able to do on my own, basically, so although her title is she's England's general practice nurse for the whole of England for NHS England, it's as a person she's 4 times bigger than that. She's absolutely awesome and very generous. Can you put the second slide up, please, Steve? Like I say, we did 3 road shows in Yorkshire. Each one has got its own director. I'm the director for the shows in Nottingham, so it kind of made sense. So the director in Barnsley, the first road show in Yorkshire, was Andrea Parkin, who did an awesome job creating the Barnsley Road Show in the Glassworks, and they've also organised a date for next year, the 7th of June, in the Priory campus in Barnsley. If you want to slip that into your diaries for next year, 2024. Can you put the next slide up, slide 3, please, Steve? This one refers to the Sheffield Roadshow. The director of that was Joanne Ward, and she did an absolute brilliant job putting a team around her, much like Andrea did with the team around her, and they formed a Carers Roadshow in the Winter Gardens in Sheffield. I did admit to say that the one in Barnsley, they had 20 stores, and they actually turned down 20 stores because they didn't get the room. But in Sheffield, they learnt about the room and ran their road shows in Winter Gardens. It was massive, brilliant place. And they got 36 stalls all laid out there, and they did an absolute sterling job. And that was the first Sheffield road show. Could you put the 4th slide up, please, Steve? Because this is referring to, again, the next director who's the director for Leeds is Hayley Ingleson, and she's designing, got the team around and designing the Leeds Road Show at Christmas on the 8th of December. So you will take note of that, because that's yet to come. And if you can get up to there, please do, and bring your friends with you. It's in the Kirkgate Indoor Market. Hayley is doing an awesome job, but she can't go to the show because she's got to go down to London and get a Queen's Nursing Award, which is brilliant, absolutely awesome. It's a shame it's on the same date, but I'm hoping to get up the day before and meet her personally, because I know her so well, but it's always been on camera like this, like, you know. The plan is to do the road shows in every city and county in England with the help of Louise and everyone here in this webinar, because you'll know the people I need to talk to and to get a Carers Roadshow in your neck of the woods, on the streets with where you live, for your local organisations, putting them together with your local communities, and just watch the magic happen, because that's what a roadshow produces. It just works, and it works on so many different levels, and there's no downside to them. Everybody benefits. So so by introducing me to the people that you know, I can take it one step further. That's my take on what I want to get out of this this opportunity at this webinar, like, you know. And I want to do face-to-face shows on the streets, you know, where you all live, right across the country. Producing roadshow, I've been producing roadshows for 10 years, or it seems like 200. I've also had the store loaders over those years, capturing the conversations we've all had. And in the 7 years up to COVID, I did 7 years, 22,000 visitors, and I produced a database for all that, a spreadsheet database, and captured all the conversations that each stallholder did. And we did the same for this year when we did the 19 roadshows in Nottingham as well. And all that data is like gold to the decision makers, quite honestly, like, you know. And with that in mind, and everybody's kind of impressed in Nottingham that I've actually been offered a co-chair and join forces, a co-production with Nottingham City and County, and been offered a co-chair to a newly created co-production collaboration to continue to use the data the roadshows produce in the coming years. So essentially, they want to run the roadshows to keep the momentum going, so they can get all this data this side of COVID, trying to find out what people are dealing with when they've been through COVID. It's dangerous to assume they still want the same things post COVID, and that's that's the information people are hungry for. And finally, you're going to shut me up now. Finally, I'd like to finish on a high. I said at the top of the presentation that I developed type 2 diabetes in 2002, which I did, and I've had it all that time. Well, in September 22, that's last year, I decided to get rid of the diabetes. I weighed 22 stone, and now I weigh 14 stone, and my diabetes is gone. My doctor has took me off all the medications, and I'm pill free, and losing 7 stone in a year did the trick. So that's me bringing you bang up to date with what's happening with me personally, what's happening with my son, which is also personal. It's a battle we do it to ourselves, and what's happening with the roadshow, which is something very, very close to my heart. And thank you for hearing me rattling on. And now I'd like to get to the best bit. Any questions? Don't tell me I've been on mute. Don't tell me I've been on mute all that time.
Yeah, sorry, Trevor, could you we missed that.
Here we go.
No, that it's just, I mean, inspiring doesn't really cover it. Your personal experience, but also the way that you have kind of taken your experience and then turned it around to benefit others. It's just absolutely magical. So many thanks. I've kind of stepped in because I have a question, and it's kind of a question and a comment. One of the things that took me a little bit to realise was that when you do a Carers Roadshow, you talk about it being in a marketplace. And when I heard that at first, I thought it was like a metaphorical marketplace, but they are literally in marketplaces, aren't they? Could you tell us a little bit more about that connection between the roadshow and marketplaces in towns? Why do it in a market?
Well, it's actually in cities. It's difficult to find a market. You can find them though. They are there, but in the counties they're essential because all counties are spread about. Like they all live in small villages, but they all have a market town where they all come to congregate for to get fresh food provisions, meet people, and all kinds of things. And so they've always got a central point, which is a market. So I figured that if I can have get some stalls on a market day as well, then the people that are fractioned all over the countryside come in to buy their produce and everything. They will meet the road shows there as well. So you're actually offering support and help for health and social care and mental health issues right outside the stall selling fruit and veg. This is where you capture them, right? And that's the idea of the market being in an actual market. It really it just takes off, like works.
And am I right in saying that you create that relationship with the stallholders and it all becomes mutually beneficial? You in effect are bringing people into the market, and then therefore the stallholders literally got a stall in which I'm just thinking of that kind of idea that you've actually got a place in which to put out the leaflets and to make sure that the carers can get that information on the day.
Oh yeah, I mean the roadshow is not just leaflets. Roadshows create conversations, and we capture the conversations. But also, I mix the stallholders up on purpose. So you've got cancer care right outside of legal advice, or you've got dementia care right outside of benefits agencies and that type of thing. I mix them up on purpose for the main reason is because they get to know each other, and it's not just a face behind the email. They get to know where each other goes on holidays, how many kids they've got, and everything.
Yeah.
It's a
Hello,
real it's a real bond.
Okay, how are you?
I'm sorry, who's Andrea?
That's all right. I was just going to say,
Bless
could you,
you.
if you're not talking, could you go on mute,
After
please?
all that, Trevor's like, we're not sending out an orange banner. You just see me email.
Hello, talking about the orange banner. Can you put yourself on mute, please? I think she has done. That's okay. So that bonding that the people have, it's a true bonding, and they tend to work together outside of the road shows, which means they're still working together, and that leans towards a seamless service, which is what vulnerable people want and deserve, quite honestly. So it goes to I can push it to that end just by mix them up and put them together and help them to work side by side, because a lot of these organizations have never met each other except up through emails, so it's a true first time meeting, like
Yeah. And the magic that creates. It was certainly my experience at the Sheffield event. It was that I can't really describe it. It's energy. It's like a magic that happens.
It is.
Yeah.
It's a bit like baking a pie. You put all the ingredients together, and then you put it in the oven, and it just creates itself. And that's what a roadshow is. And I think it works because it's simple. It's a bit like cat's eyes in the road, like as soon as you switch the headlights on, it shows you the road, and Percy Shaw, who invented, dreamt up that idea, bits of glass down the middle of the road. That was an awesome, and I really admired that guy for actually dreaming up such a thing, and I liken it to the road shows. The road shows is you get each store has its own referral system, so therefore you get the whole thing is quite immediate, a lot like cat's eyes. You get the support there and then. We've had carers in crisis come to the road shows, and they've got the support they need the same day. We can turn stuff around like and that's something big organisations like NHS England and city and county council, they can't do that. They're too big, but we can move around quite supple, simply because we're a road show and we're active and we can do stuff like that.
Yeah.
Right.
Trevor, I'm aware that we're running over, but I'm also aware that you're holding 73 people in a room. So there's obviously a lot of interest in what you're saying. So before we close, I just want to see, does anybody have any, Louise, I don't know if anybody's got any sort of questions for Trevor that they would like to put. I think all the comments in the chat box so far, Trevor, have been contact me. This is how we can get you here. So please get your pen out.
Okay.
and we'll send you across, obviously, all of
Gotcha.
these email addresses. But Louise, I wonder if you wanted to.
I thought it was here till 2:30, but never mind.
No, I just wanted to say I saw the first roadshow many years ago. I think it was in Mansfield, Trevor, when you were doing one. I got an invitation there,
Yeah.
and I was really impressed with the conversations. And as Trevor said, how what matters to carers can be dealt with in real time. We know that the NHS and social care system are struggling, particularly when we think about referrals. You know, people are on waiting lists for operations. They need somebody to talk to today, and they need the healthcare and voluntary services all in one place. So we call the Carers Roadshow a street to strategy, you know, because it is about meeting carers and families where they live, work and play. And it is in the local community. And Joanne's on the call here today, Trevor. I don't know if you've noticed, from Sheffield. And she does a tremendous amount of work alongside others. So what we don't want, and I think Trevor will agree, but correct me if I'm wrong, is we don't want one-off events, because, you know, carers have had lots of one-off events, particularly big conferences where people gather and it's the great and the good there, and they've been promised the earth and got very let down. What the roadshow does, as Trevor says, it's very simple. You know, it should be at least an annual event in every town and county, and that way you're making a sustainable change for carers on the doorstep where they live. I'm just going to hand over to Joanne, actually. Joanne, if you want to.
Hi everybody, and thank
Hello,
you.
Joanne.
Hi, I'm fine, thanks, Trevor.
Great.
Lovely to see you again.
Nice to see you too.
Yeah, and yeah, brilliant to work with Trevor and obviously incorporate Sheffield within the roadshow. I'm not prepared because I didn't know if you wanted me to say anything, but we were so pleased to be able to work as in a partnership, in an integrated partnership with our council, with our carers centres, both young carers and the adult carers in Sheffield, and with the ICB. And I think that's been the strength for Sheffield, this one, and possibly we had 3 target audiences as well, didn't we, Trevor?
Yes, we did.
We were very lucky in our planning to have to look at unpaid carers, to have a business section, a networking section with our Chamber of Commerce. That started in the morning. We had a breakfast because we wanted to capture our businesses supporting our employers with unpaid carers, and obviously inform them of the rights. And we had and we also had sessions and presentations going on for our health care professionals to come down to, and obviously a huge amount of networking done by the voluntary sector. And so I think we got your concept, didn't we, Trevor, and we ran with it a little bit in Sheffield, which was brilliant.
You did absolutely. Also, the location was absolutely mind-blowing.
Yes. Yeah, and I think that's important, isn't it, Trevor? I think you would agree that the location is essential, and also from communications but I think it was evident for Sheffield that because we were so joined up, we could maximise that and that communication across all networks, and it felt very united for Sheffield. I've put my details. I don't want to go on too long because we're still now using this and building on that energy that Campbell's talked about, because we're going to have a review meetings. We've got we're joining everybody into the momentum and keeping that momentum going. So it's been a great opportunity for Sheffield. And as I say, we're not necessarily committed to doing a full one like this again next year. We thought we'd be doing a full one in Sheffield City Centre biannually, but with a vision to go out to communities. We want to take the roadshow out a little bit like your concept, but really getting out to far-reaching, getting to identify carers in their own communities, working with our primary care colleagues in PCNs, and really trying to move the roadshow out into communities. So we've got a business planning meetings now, and so it's been a catalyst for a great deal of movement. But it was, thank you.
That's absolutely awesome, Joanne, and that's exactly what you can do with the roadshows. Is if you do, you can do it in many places, and when you go into many places, you can make it a little bit smaller because you've got a smaller population, but you can still make it just as relevant as the big one, because there's a hunger for information. There's a hunger of telling people what opportunities they've got and what options they have that they don't know they've got. Plus the fact you've got the stallholders and you've got the hierarchy; they want to be a part of it as well. So it's got multi levels of interest that actually drives the roadshow all on its own. It's got its own momentum once you get it going. I do it in Nottingham for many years. 111 roadshows I've done in Nottingham. But it's that momentum that we can gather in Yorkshire and the rest of the country, and do it many times. You just have to scale it down, but it's still just as relevant. So a big one is very useful as a taster, and then we can start moving around the more local areas, which that's where you can make it count. And that connection for the professionals is awesome. They feel so empowered when they get the questions from the people that they're trying to help, and that conversations we create is, well, sure magic.
Yeah, very much so. We obviously, from a health perspective, we had our nurses down there as well, and that was very well received, picking up unidentified, areas of health that we're really keen to promote. And I'm sure Louise is keen to, because she was obviously gathering all our primary care development nurses to support this event, because health is obviously a large component of supporting ongoing unpaid carers.
Yeah, absolutely.
Joe, Trevor and Joe, apologies for dragging you into this, but as somebody that's put one on with
absolutely
working together, I just wonder, there's a couple of questions in the chat box that I think you could, and it's that idea. The first one is about it was about how did you get involvement? So there's a question with regards. Let me see, from Lindsay with regards. How did you manage to get a stall? Did you have to go to the council? How do you actually get? How did you go about speaking to the people in the market? And a second question from that is, have you got guidance on how you've done that written down anywhere, Trevor? Is it on your can people sort of get it from your website with regards how you've gone about setting things up before, or? So that's two questions slightly before.
Can I do them in reverse? Because coincidentally, I've just about finished a document which is right from getting a roadshow from fresh air to actually running one, and step by step going through it, and it's all detailed, and I'm just giving it the final touches, and I'll send that out to anybody that wants a roadshow, and it'll be fully explained. But there is a routine there that I've developed over the years that works. And just quickly, you start with finding a venue, and then they always want money, so you ask for a charity rate, or I get them for nothing after, if you talk to them long enough and explain what you're doing, because why the roadshow exists. There's not a lot of money in it. It's all about doing stuff. People benefit from it, but it's nothing to do with money. It's to do with actually doing stuff. And so you get your venue together. Once you got your venue together, that gives you not just the dates, but it also gives you the number of stalls. And then, like I did 19 roadshows this year for Nottingham, which added up to 300 stalls. It took me 4 weeks to fill them. with 58 different organisations. Once you get the following, everybody wants a piece, and then you go, then you pull it on, you pull it out there. You know, you go to locations, do the business, and there you've got a running roadshow, basically. Whether it's one or whether it's 21 shows, it doesn't matter. It's the same routine. Right, you know, and I've got all that documented, and anybody wants that, just get in touch with me, and I'll be sending that out. I'll say safe to say from the 1st of December, that'll be all in one place, and little document I can send out to anybody and everybody that wants it, and I can advise them and guide them through as a consultant, like I've done with the 3 shows in Yorkshire.
And Joe, maybe this one's for you. How did you go about? Emma's asked about how you go about promoting a roadshow. What was the comms kind of element like from a Sheffield perspective?
I suppose the difficulty is for us. We came from large partnerships. We had the resources within the ICB. We had the resources in council, we had the carers. So coming to a planning group, you had key representatives such as myself that could access or have ways of accessing into already, you know, agreed communication. So I could speak to my GPs through a GP bulletin, we could get comms out, and so did the council. So I suppose if what I was looking at the comments, if there's anybody doing a smaller scale one to Sheffield, which I can appreciate, is possibly to reach out to your ICB, see if they've got anybody overarching with carers, and see whether you can engage in somebody equivalent of me or somebody within a team. I'm sure Louise and I'm more than happy to help and get that sort of system working with you instead of you having to do it on your own. Really, there's got to be some mechanisms to get into this communication. We followed social media, we tweeted each other, and our comms team worked very closely together and we had agreed comms, so we did have a bit of a planning meeting. But again, we're writing ours down, happy to talk to anybody literally on the minutiae, because you have to live and breathe this, don't you, Trevor? The day-to-day things, the insurances, the consents, you've got to have indemnities, insurance for things like that, the logistical things, talking to the council, and obviously asking if they'll negotiate on a fee. We managed to, I'm not saying beg, steal or borrow, but we managed to access little pockets of money across organisations that eventually did break even. I think we did it for £1,500 in the end.
Really? Is that all?
At the bottom line. And that was because of generosity of other people and a little bit of, lots of support. So we did it for £1,500. I must say we managed to coordinate with Carers UK and their roadshows as well. So whether that's a call to Carers UK, because they do their roadshows and they came and join ours so that we didn't have 2. So that made it feel even stronger, didn't it, Trevor, that Carers UK were with us doing their own little bit.
Yeah, most definitely. They've actually been in touch with me since and wants me to join them. Their teams in London in designs when they get around to the next round of roadshow they're going to do next year. But that term of the amount of goodwill in Sheffield, in Sheffield, and the same amount in Barnsley and in Leeds. For the first time, because it's a different way of working, it fascinates some people, it frightens others, but that generosity, because you get the right people. I did 19 roadshows in Nottingham this year, and believe it or not, I did it for £700. 19. I mean, I had councillors that own the markets telling their managers to ring me up and ask me how many stalls I want for nothing. And I was asking for 10 and 20. I got one market to give me all. It gave me all 28 stalls, and I filled them. Basically.
I mean, I agree. The generosity, Trevor. We did it with on the back of the Mercure Hotel. They provided us with the tables, access. access to toilets, you know what I mean? And they were very generous, weren't they, on the day? So, as others were.
Except there was free drinks as well. I was impressed with that. You know, coffee and tea, man, not scotch.
Yeah.
And
okay.
I could chuck myself into that mix about connectors because from a sort of regional level, I should say that things are a bit up in the air with the ICBs at the moment, ICSs across my region, but don't let that get in the way. I'm really happy to facilitate conversations, introduce people and network and introduce you directly to Trevor. As I say, it's an absolutely incredible offer. Can I just comment? I love it when we get strategy developing live in a chat box. If you want to see a comms thing develop live, you can just see how Trevor's guide, as Steve's just said, he'll put it on the Futures platform. So, I mean, and that's all happened in the last minute in the chat box. So, so if we get
likewise, Campbell, I've just popped in the chat box. I'm happy to share any of the letters, any of the invite letters, any of the consents. We've tweaked our feedback forms and things like that. So we've got templates if anybody would like to. Don't reinvent the wheel if you don't have to, because there's enough to do anyway.
Yeah. Another question from that I also thought was really interesting was the lead-in time. So say I wanted to put one on, say we were looking at doing, I'm in Leeds at the moment, and there's one starting in December, but anyway, how long does it take? How long before the kind of initial idea to the actual roadshow in your experience?
Your biggest stumbling block is getting into people's diaries. So the earlier the better. You need the location, you know, the venues, they've got diaries, so you know, earlier the better. I always start my roadshow if I'm doing multiple roadshows. I start them in January and sort out the venues and get them booked. That leaves me with dates and also number of stalls, and then February I put the word out that I've got so many stalls, which you know, come and get them, and it's first come first served situation, and get them filled up. And then in March you start to develop the posters and the deliveries and the comms and everything else, and then you start the road shows in the summer months. I've always done between May and August, might go into September, but it's that's the routine I've been doing, because the secret is getting in people's diaries, the venues diaries, the stall holders diaries, and otherwise you kind of stuck. You can't have the days you want, like, you know, I've had road shows on Carers Week and you know, and different occasions like that. So to get those specific dates, you've got to get in early. So that's the secret of it all. Basically, start early to get inside the diaries. It doesn't matter when you start, but it's always earlier the better. Like, you know.
And just a quick plug, Trevor mentioned Carers Week. This Thursday is, of course, Carers Rights Day. So keep an eye out for all the events that's happening in your area with regards to Carers Rights Day. Okay, does anybody have any other questions? Okay, Louise, I don't know if you want the final word, but I just wanted to just thank. I think what we've done today is Trevor's not only. I just expected the kind of how-to guide us to do the Carers Roadshow. I didn't know your story, Trevor, and I am even more humbled when I hear what your life has been. It's just absolutely incredible, and it's just the energy, as I say, that I felt in Sheffield, I think, comes from the energy that I'm aware that Joe put into the event in itself, and it just all pays off. And Louise told us the impact. We've got a measurable impact on this, and for virtually no money at all. 1,500 quid, I can't believe that. And yeah, sorry, Trevor.
No, I think the reason the roadshows has got momentum is the fact that I took the money out. The money kind of confuses things, and it puts a different emphasis. Because, you know, if you're trying to plan something, it doesn't matter what. If you try and plan something and start with the money, you'll never get that plan off the ground. You have to start with the plan. So, you know, it's like assessments. Assessments nothing to do with money. If you're assessing a person's needs will remain a person's person's needs, whether you've got the money or not. So the money is a separate issue. You assess a person, find out the needs, and then you bring the money in to see what you can afford of what they need. So it's that conversation you need first, and it's got to be a meaningful conversation. That's why I've got active listening and all the rest of it. You don't make your mind up halfway through the conversation that you got the, I've got most of it together. That's near enough. It's like shooting for the moon with a rocket. You're only quarter of an inch out, but you're going to miss the moon by a million miles, so you need to listen intensely, let them finish the story, so you get the full gist of the problem, and then apply what you can and can't do, with the budgets that you're playing with, basically. And the roadshow, I took it all out, and it's just got its own momentum. It's just so incredibly cost effective. It's so easy that half the people in England don't even believe me, but it's beginning to work, and that becomes what Joanne was on about. It helps when we've already done a roadshow, get some video out there, and then people can actually see it and feel it, and and then you say, well, I've seen it happen, so I know he's not talking gobbledygook, so let's have a crack at it, and it's getting momentum. And just to finish off, for next year, I've got North Yorkshire that Campbell well knows about. North Lincoln, they want a roadshow. Newcastle wants a roadshow. Manchester, Greater Manchester, Derby, Birmingham, and Bristol all want a roadshow next year. So I'm going to be well busy, and I'm going to enjoy every second of it.
Thank you, Trevor. Thank you, Joe. Louise, I wonder if I could give you the last word.
Yeah, I just want to say thanks, Trevor. And Anne to Campbell and Helen and the team at all of you here today for listening to us. And from a nursing point of view, we are forming nurse carers partnerships. As Campbell says, we're keeping the data of who's attending, we're capturing those critical conversations, but also our carers are getting much needed health checks and advice. It doesn't matter if it's on heart issues, blood pressure, cancer care, palliative care, dementia care. We're there as nurses, as nurse volunteers. We give our time because we feel it's so important. So we're here to work with you as a team, a big team. If you need me, just email me and we'll do what we can. Thank you.
That's awesome, and that's a brilliant response. And I think the roadshow gives a perspective, not just a health perspective, it gives a social care perspective as well, because they do actually go together, and it forms a more rounded view of people's needs and the kind of support that people want from you all, and it's brilliant. And what you just said, Louise, is is on my back of my next stand up.
And with that, I'll bring it to a close. So many thanks all for your time. Trevor's email address is in the chat box, and his website's there as well. So thank you all. We'll see you again. Bye.
Thank you, everybody. Thank you, Campbell. Thank you, Louise. And I'll see you tomorrow, Louise. Bye-bye.
Hi, thanks, Trevor.
Bye-bye, everybody.
Thank you, Trevor. Bye.
Thank you.